Hi, my name is Marla. I'm the clinical educator for the emergency department and the ICU. I'm also a nurse practitioner. Also, I belong to the hospital emergency response team and the corporate emergency response team. And with my partner here, Marie, who's our risk manager, as well as a member of the hospital emergency response team and the corporate emergency response team, we are going to be showing you how we do PPE, personal protective equipment, for patients that are in our hospital with COVID. Marie, what are you doing with all those masks on?
What do you mean all these masks? Aren't we supposed to wear all these masks?
No, you're only supposed to wear one mask.
One mask?
Your surgical mask is what we wear in the hospital, and when we're out in public, we don't wear all those masks.
Okay, I'll take them off.
So we need to take off your mask, Marie. So Marie's going to take off her different masks, and then we're going to show you how we put on our personal protective equipment and explain to you a little bit about the masks. That's right, there's your surgical mask. That's what we wear here in the hospital as well as when we go out in public. And we don't wear the surgical mask though in patients' room that have COVID. So we switch them to a different type of mask called N95 mask. The N95 mask, we have two. The orange one we refer to as the duck because it has what looks like a bill. And the green one, which is the turtle. As you can see, it looks like the shell. The clinical people that have to wear these masks have to be fit tested, meaning that we have to go to employee health, and they have to ensure that these masks will provide the best protection while they're on our face. These masks are only worn in rooms where there are COVID patients.
Okay. So now I'm going to show you how we properly put on our PPE equipment.
So the first thing that we need to do is to make sure that Marie has her properly fitted N95 mask. So we don't wear masks that belong to others, obviously, but we need to make sure that the mask that we're wearing is what has been approved by employee health. We want to make sure that there's a good seal on the mask because we don't want air coming in, and we want to make sure that we have a good seal. Next, Marie's going to put on her hair bonnet. The staff wears hair bonnet in the rooms to protect our hair and the top of our heads from any type of exposure. After that, she's going to go ahead and put on her eye protection. In all patient rooms, regardless if they're COVID positive, persons under investigation, meaning that they're being tested, or even our regular patients that we care for, we're supposed to be wearing some sort of eye protection, whether it's the glasses or the face shield. When we are in patient rooms with COVID and we're doing any kind of procedure or taking care of the patient, we have to wear both the eye protection and the face shield. Then Marie's going to go ahead and she's going to put on a small pair of gloves. So at the hospital we have various sizes, so she's going to put on 2 pairs of gloves, the first pair being the smallest size. So the next thing that we're going to don or put on are the patient gowns. These pink gowns were donated to Baptist Health South Florida by Ford Motor Company. They are made from recycled airbag material, so they're very strong and they're very hot. They only come in one size. The back is adhered with a industrial strength Velcro. Over time, because these gowns are commercially laundered and brought back to our facility, some of the pink stitching from the gown has gotten into the Velcro. But we have to still make sure that it's tight around the neck so that it doesn't fall off while we're doing patient care.
I'm going to go ahead and put it on.
The reason that we wanted to have the smaller pair of gloves go on first is because these gowns have thumb loops. And the thumb loops secure, they make sure that they secure into place when we're using, so when we move our arms forward, the gown doesn't fall off. I'm going to go ahead and attach the back Velcro for Marie, as well as tie her on the side. So we just tie this like we would do any other type of ribbon or lace. So now Marie is completely enclosed in the gown. We don't want any opening in the back because remember, once we're in the room, everything is considered contaminated. So we want to limit the contamination risk at all costs. Next thing she's going to do is put on the larger pair of gloves. And because the sleeves are so big, she's going to go ahead and move the sleeve back and make sure that the glove goes all the way up the sleeve as far as it will go. So when she does start to do patient care, that none of her skin is exposed. So at this point, at this time, Maria is ready to go into a patient's room with COVID and do patient care. She's fully protected, her eyes, her hair, her body, her hands. We don't wear shoe covers, so we're not going to, emphasize that. But this is the way that the nursing team must go into a room with the patient that has COVID to care for them. So the next thing that we're going to do is show you how to get out of the equipment. Doffing, as it is called, is the most critical time because you've been in the patient's room, you've done patient care, and now the risk of contaminating ourselves is greatest at this time. So what we do is we go out of the patient's room. Remember, the door handle is also contaminated. When we come out of the patient room, right away we get hand sanitizer and we clean our gloves. We don't take anything off until we use that hand sanitizer. Once the gloves are dry, then we go ahead and we start to take our equipment off. So the first thing that Marie's going to take off is her face shield. Whenever we take off equipment, we do have a cleaning and drying stations available where the equipment is placed so it is cleaned after each use and then allowed to dry. We do follow the manufacturer recommendation for the type of chemicals that are used to clean the equipment and allow them to dry. So right now, Maria's going to go take off her face shield. She's going to lean forward, and she's going to take it off. We don't ever want to flip backwards. We always want to go forward because we don't want to risk contaminating ourselves or somebody that may be standing behind us. Then Maria's going to go ahead and clean her gloves again. She's going to let the gloves dry before she removes her eye protection. Once she removes the eye protection, she's going to grab them from the side or as close to the top as possible, lean forward and remove them. Remember, we don't want to be touching our face or our hair. The next thing she's going to do is clean her gloves again. And she's going to clean her gloves again, and she's going to go ahead and she's going to remove her gown. So now you either need a spotter, meaning another person on your team, your clinical team, to undo the back, or Marie could undo it herself. And we need to undo the side. Remember, if there's a spotter, they also need to wear gloves. So now she's untying herself, and she's going to go ahead and she's going to grab the gown away from her neck and pull it straight out. Once she pops that Velcro, she's out of the gown. She needs to go ahead and roll the gown. The outside of the gown is contaminated, so we want to only touch the inside of the gown so we're not exposed. Then Marie will take off the outside or outer gloves with the inner part of the gown. That way she does not contaminate herself, and those old gloves will go in the trash. The pink gown goes into a recycling bin where it is then sent off the campus of the hospital to be laundered and then brought back. So now that Marie has taken off her gown and her outer gloves, she's left with one pair of gloves, as well as her N95 mask and her bonnet. Now she's going to go and she's going to clean those gloves that she has now. She's going to let the gloves dry, and then what she's going to do is remove her gloves. She's going to put on a new pair of gloves that are clean. Why is that? Because she's going to remove her mask. And as you go near the mask, you're close to your face and your neck, and we want to make sure that just in case she accidentally touches herself, she does not contaminate herself. So she's putting on the new gloves, and then she will go ahead and she's going to remove her bonnet first, leaning forward, taking it from the back to the front. She's going to go ahead and wash her gloves again. Remember, these are the new gloves that have not been in the patient room. And then she's going to carefully remove her N95 mask, reaching on the top straps, bringing it forward to the front. Once she's done with that, she will clean her gloves, take them off, wash her hands with soap and water, and put her surgical mask back on. That is the complete donning and doffing process that we do here at Doctors Hospital for patients with COVID.